So hello, welcome to TC Fit Fitness Forum. Fitness intuition is our discussion today. This is an open forum, so I really encourage you as part of the audience to pop in with your questions or comments. You can do that by unmuting your microphone or in the chat box as well. And I am TC Fit trainer Michelle. I also have TC Fit trainer Kendall on the call and TC Fit physical therapist Matt. So hopefully you're starting to recognize our faces if you've attended some of our other events. But we're happy to be sharing the next 25 minutes with you. And like I mentioned, we're talking about fitness intuition, which is just a fancy way of saying, what should your exercise feel like? And how does your body give you clues for when to push and when to rest? Again, ask your questions at any point, but in general, that feeling of how intense your exercise should be varies a lot based on your personal goals. So for general health, or that kind of just keep moving goal, you think about going out for a walk in your neighborhood, or maybe taking a casual bike ride. These activities may be less physically intense, but they do offer a challenge as far as finding mental motivation and that type of thing. Or if your fitness goal is a little more about improvement or physical change, maybe you're trying to build muscle mass, lose body fat, or improve your heart health and your cardio fitness. With those types of goals, we really do need to ask our body to work harder than what it is used to. And that type of activity can be uncomfortable. But one thing that I know you've heard from all of our trainers and probably all of our live stream classes is that exercise may be difficult, but it should never be painful. So a couple of guidelines, you can increase your chance for fitness success and decrease your risk of injury by always gradually increasing your exercise intensity over time. So if you're new to exercise, you don't want to go out and try to run that 5K right off the bat. You want to start with a walk to run routine, gradually increase that distance, or a lot of times we even track by minutes. So starting with up to 10 minutes of activity and then adding a few minutes each week to increase that duration and that intensity.
Michelle, a good rule of thumb, I'm sorry to interrupt, especially when we're coming off of an injury, but I think it holds true even re-entering if you haven't been exercising a while, is just that 10% rule. And I think that's actually been validated in many different ways. You can break things down mathematically, but really only increasing the load, the intensity, the distance, the time by only 10% a week, which if you break it down mathematically isn't a lot. And you still should never have pain, but that's probably a good rule of thumb to follow. And I think that if you're short of looking at a specific chart, I think you can use that effectively and follow that 10% rule.
I like that 10% rule as well. Another tip would be to always warm up and cool down. So allowing that 5+ minutes on the front and back end of your workout, that becomes increasingly important as we age. And we want that warm up to physically increase our body temperature, our respiratory rate, it lubricates our joints. And at the end of our workout with that cool down, that gradual cool down is going to help us safely bring our body back to a resting state. And then I also want to just point out, if you have any underlying medical conditions, you should always talk to your doctor before starting a new exercise routine. You just want to get that medical sign off and know if there are any restrictions that are specific for you. And then, of course, always stop exercising immediately if you're having chest pain or you're feeling an onset of a headache, nausea, or dizziness. This is your body giving you signs that we should find out what is causing that underlying condition. Matt or Kendall, I'll just pause for a second. Do you have any other, signs to recognize that are major caution signs with exercise?
Matt, I'll let you take that one from a PT
Okay.
perspective.
Yeah. Well, I think that, you know, Michelle and I were chatting, and Michelle, I don't want to steal your thunder, but the muscle getting to a point of discomfort, the muscle belly, fine. My quadricep is burning with these lunges that Kendall's making me do. You know, my glute is sore from this monster walk. Generally, I think if you're maintaining your form, that's acceptable. And in fact, probably if we're going to get that training effect, needed to actually get that muscle to work and change shape, strength, whatever you're looking for in your workouts. I tell my patients that burning in a tendon and in a joint is probably not acceptable and not something you should probably work through, even if you're able to maintain form, that those should be handled a little bit differently, especially for those of us that are reaching middle age. And I did see that kind of side swipe dig at me being middle aged, Michelle, when you're talking about as we age. But things change. I tell most of my patients after 35, all bets are off. The ability to heal is decreasing. Growth hormone, testosterone, all the stuff in our body that helps us heal is going downhill. How do we prevent injury? That is keeping a good baseline of fitness and strength. But with that, if people who are active are going to get dinged once in a while, so you need to know what you're feeling, honor those feelings, never any pain, but muscles fatiguing quickly and getting sore during a workout, as long as you're maintaining form, I applaud it. Suck it up, get after it, do the right thing. Burning in a joint or tendon, never something you should work through.
I'll just add on to that from a personal training perspective. Usually if I'm working with a client, and let's say if we're doing squats, you know, if someone is starting to feel it in their low back, I'll typically have them take a break, reset. A lot of times when our muscles start to fatigue, we start to incorporate different muscle groups and, you know, kind of going into different places. I'll have them take a little break, try it again, resetting. If it's still not working, you know, then your body is just getting tired and it's time to move on to something else. So that's the other thing, is just recognizing, again, what Matt said, the difference between the burning and the muscle fatigue versus the pain, and then it's time to move on.
Yeah, and something to think about as well, as I think about what you said, Kendall, is it might not be your knee when you're squatting. Maybe it's your low back. Well, then it's time to also think about, okay, where should I be feeling this? Is this an okay pain or not? Reaching out to any of us anytime about that's great. Maybe, I know we're not back on site yet, but watching your mechanics to make sure that things look good is something that we can help you with virtually as well if you've got questions. But not just thinking about the joints that are directly being affected or the muscles, but maybe the ones that are indirect. Always, with most exercise, especially the compound movements that our team is doing in their group fitness right now, is going to use your core, and making sure you're stable in through the hips and low back, and that lumbopelvic area is important.
Mm-hmm.
Matt, you're talking about mechanics, which is one of the bullet points we had on our list today. So I do want to just open it up to the audience. If you're looking for any specific exercise or type of exercise form techniques, feel free to throw that in the chat box and we'll point our conversation that direction. But there's one tip that I find myself using for myself and with all of my clients. I use it when I'm sitting at my computer and when I'm exercising, which is pull the shoulder blades down and back. So that kind of proud chest, yep, as we all adjust.
I think everyone sat up a little taller.
Squeezing those shoulder blades together, pulling those shoulders away from the ears. Kendall, I hear you often talk about abdominal muscles and engage those abdominal muscles. Can you tell us a little more what that means or how we do that?
Mm-hmm. So a lot of times you'll hear us say, draw your belly button in toward your spine, navel to your spine. And, you know, what we mean by that is that's how you are engaging your abdominal muscles. So let's say if you're doing a squat and you're allowing your belly to hang, that's meaning that you're most likely going into your low back and allowing your abs to just hang and not engage. So that's when we start to talk about, okay, draw your belly button in, think of your torso as a corset, keep it nice and tight. Typically, clients understand from from that. But also sometimes, people learn differently. So then I just need to find different cueing for people, for, different people. So that's kind of a typical one that I use.
Yeah, I like the thinking about putting on your jeans. You're going to button the button and you're going to zip the zipper. So you kind of have that drawing up motion as well. Also thinking about using your muscles in your body kind of equally from side to side. So exercises that involve tilt or rotation, making sure that you're not favoring one side more than the other. Or I think about like yard work, and we go out and we rake and we shovel or do those types of things. It's hard to get our brain and our body to flip and do that activity on the other side, but we do want to try to even that out as best as possible.
Michelle, I think you hit on something really, really well. Just even from an injury standpoint, switching that up is gonna change the micro trauma on those joints. But it also, because it's uncoordinated to use that other side, it's good for brain fitness too, right? And we hate to see people lopsided. That would make me very upset, and especially Kendall as a Pilates practitioner.
Yeah.
I sometimes actually start clients on their non-dominant foot or their non-dominant arm, just to, and it also kind of enlightens them as far as how much stronger the other side is, and that. But so I tend to start with non-dominant as well.
And the other side of that, Kendall, is I think that's smart to do that because we are hardwired neurologically right to left. So improving the form on the non-dominant side is going to help that dominant side perform as well.
Mm-hmm.
And whether it's strength training or cardio training, I really personally have to make the effort to find that mindfulness or to check in with my body, because a lot of times I'll try to jam out to the music, or I'm zoning out in my own thoughts, maybe when I'm running or biking. And so to take that 30 seconds and say, what is my body position, can make a big difference in how I feel at the end of that workout.
Mm-hmm.
Before we move on, Matt, do you have any other kind of general form or body positioning tips you want to touch on? And that's okay if you don't.
With respect to what? I mean, I think people are sick of me talking ergonomics, but I do think the most simple thing that you can do, as I think working from home, though I know people are gradually getting back in the office now, but I don't think working from home is going away. I also don't think working from home permanently is going to be the way. I think it's going to be a hybrid for most people going forward. But the most simple thing you can do from a postural standpoint is remember that your tissues receive nutrition through movement. Your discs throughout your spine, the joint surfaces, there's no direct circulation or nutrition coming to those tissues unless you are moving. Even if you're sitting with good posture, you're starving those tissues. We were designed to move. So the most singly impactful thing that you can do from an ergonomic standpoint is move and get up away from that desk, even if you've got the world's fanciest chair and sit stand workstation. Get away from that, go for a little stroll, do some stretches. We've got some videos posted to get moving as well, but it might be simply just taking a walk around the block. So how's that for plug-in more ergonomics, Michelle?
I love it. I love it. We do have a question in the chat box, and I know this is one that comes up frequently, so I'm glad we're talking about it. Michelle would like to know our point of view on percussive massager guns. So Theraguns, I'm trying to think of the other brand name. Hypervolt, thank you.
And a lot of things in between. So be careful what you buy.
Yes. So when we feel like our bodies are sore or fatigued from sitting at our desk all day, is this a good solution for dealing with that tension and trying to relieve the muscles? I would say it's one of many options. Matt, you kind of were just touching on that with the getting up and moving is probably our number one easiest, least cost solution to this. The more
I think Michelle froze on us there.
I think so too.
Move for 2 minutes. Oh, I just had
Michelle,
a little
you froze
glitch
for
there.
about 10 seconds. Okay.
Well, that's good, because I was thinking about our timing, and we say in a 30-minute segment, you can sit for 20, stand for 8, move for 2. Does that sound familiar?
Yeah, I think it does.
Matt, do you want to add anything else about
The
the
percussive
massage
instrument?
tools? Yep.
Yeah, I agree with you 100%. There's many different tools. These things are really popular and sexy right now. I do warn people, and we talked about this maybe in the last forum we had, that there are some knockoffs that are still very expensive, but look exactly like the company, the Hypervolt or the Theragun. And I'm not saying the other ones aren't good, but I had a guy that spent $400 or $500 on one of these and ended up with it not working and some difficulty returning it back on Amazon through China. So sometimes you get what you pay for with these things, but just from are they good? I think you're giving the tissue input. And I think anything that gives the tissue input is a good thing. There's many different ways of doing that. I would, as we discussed a couple of weeks ago, stay off of bony prominences. I get a lot of people that come in, feel this big knot. I said, well, that's the spine of your scap, that's a bone. So if you take that percussive instrument on there, it's probably going to be more sore. Make sure you're in the soft tissue of a muscle belly. If you need help with that, look at an anatomy text or something. And if some people just who are thinner, you're just going to have to be very, very precise with these tools. I have my wife, I got her one of these because I got sick of her whining because she wasn't listening to me getting up and moving and working from the dining room table. So I bought her one of these for Christmas. And of course, I probably use it more, but these things can be intense. I get it on my glutes where I have most of my problems. And right away, I'm kind of shocked as to how sensitive it is. I do think that they're effective, but you don't need a percussive instrument, and stay off the bony prominences and work your way in slowly with it. And if you're doing it on your partner or somebody else is doing it on you, have them work it in slowly, because if they come after you hard, you're going to feel it. So.
And, when it comes to pain and discomfort anywhere in the body, if this is something new, it's something mild, you're conscious of where it's coming from, like it's coming from how I'm sitting at my workstation, or it's coming from this new activity I'm doing, check in with our TC Fit trainers. We do offer free virtual success sessions, which is basically a 20-minute consult where we can talk through what's bothering you and point you in the direction on stretches or strength training. So that's when you can see your personal trainer. Matt, when would you say we should maybe take it to a physical therapist or to our doctor?
Right. Well, I feel like it depends on what you're feeling. If there was something that you did and your knee's a little sore because you overdid it, it's fine waiting a few weeks, doing the right thing, backing off, icing, a little, vitamin I, ibuprofen or something like that might help cool it off. I'm not a big pill popper myself, but when I do use these things, they're helpful. You definitely don't want to become dependent on that. But now, if there's some sort of trauma, Michelle, where, I don't know, you fell and there's abdominal pain and things like that. You ran into somebody at a softball game, ran into the catcher coming around, and you have abdominal pain. Those are types of things that you go in for right away and get that checked out. And I don't want to get people too excited, but if there's some sort of internal issue going on. However, from a joint or muscle perspective, if that joint's a little stiff, you can try the old Rice-Price technique for a while and see. I would say, if things aren't progressing in 7 to 14 days, I would, go in and see your friendly physical therapist, or, go to the orthopedic urgent care and have them take a look at things. Obviously, again, if there's trauma, excessive joint swelling, not just stiff, and there was a, macro trauma of some sort, you should probably get it checked out quicker. Obviously, if there's weakness in an extremity, your hand's weak, your foot's floppy because you have things, those are times that you don't wait and you get in right away. Does that answer and cover the gamut?
I think it does. And there's so many great virtual nurse and medical lines out there now where you can check in with a medical professional and they can kind of point you in a direction if it's urgent or can wait too.
Right. And I think that's the beauty of it, but I will tell you, and I'm biased here, it's very difficult. You can get a lot done virtually doing an orthopedic exam. So I think that's what we're talking about, is more orthopedic things, muscles and bones. But there's no substitute from going in and doing a good, thorough, basic functional exam in the clinic.
Great. I want to throw this over to Kendall because I know she was hoping to talk about RPE, rate of perceived exertion, which is a great thing to think about for fitness intuition. Kendall, what can you tell us about RPE?
So RPE can, we can kind of pair it with target heart rate zones too. And I typically use those two methods with clients. So RPE is rates of perceived exertion. It's a scale from 1 to 10. So it's really just how you are physically feeling while you are exercising. So I'd say the 4 to 5 range is going to be more of that moderate intensity exercise where you're able to, if you're on a treadmill, maybe walk and talk at the same time, or a slight jog, being able to talk. But once you're getting up to that 7 to 8, 9, 10 zone, you're going to feel pretty winded and unable to hold a conversation. So then when we pair this with heart rate, the first thing that you want to do is find your resting heart rate. So you can do this one of two ways. Either the radial artery, which is the thumb side of your wrist. Take 2 fingers, press it on there. You typically want to be sitting down for about 5 minutes before getting your resting heart rate. And then the other area is going to be your carotid, so right below your jawline. Find that area until you find a pulse, and then you can count how many heartbeats that you have in 30 seconds and then multiply by 2. So that's going to be a way to find your resting heart rate. And then from there, if we talk about moderate intensity exercise and vigorous, the American Heart Association generally recommends a target heart rate of 50 to 70%, and that's going to be moderate intensity exercise. And so that's going to be 50 to 70% of your maximum heart rate. Vigorous is 70 to 85% of your max heart rate. So now with that, to find that calculation, it's 220 minus your age. And that's going to give you your max heart rate. So if you think of your max heart rate, it's going to be, when you're up to that heart rate zone, you're going to feel pretty cashed out. So then you're going to take that max heart rate number, multiply it by the percentage, and then that's going to give you those training zones. You can also get it a little bit more catered to your resting heart rate. A normal resting heart rate can be anywhere from 60 beats to 100 beats. So, and a lower resting heart rate can indicate someone to be more physically fit. And we do a lot of this stuff on site as well. And another recommendation that I tell clients is to see, let's see if you do 20 seconds of burpees. Jot down your heart rate at the end of that, and also your RPE. And that way you can kind of see, where you're physically feeling at that moment of where your heart rate is at. So,
Kendall, maybe you touched on this, but I was told, and you can let me know if this is true, that the best time to take your resting heart rate would be right when you wake up, but not to an alarm. When you wake up, just because of how our heart rate's affected by stresses and moving and things like that. But that's probably the most accurate way to do that. Would you agree with that? So not waking up to an alarm, but waking up on your own, maybe on the weekend when I'm in bed till like 10:30 or 11. I'm kidding. But
yep.
But is that true?
Yes. Yep. That's what I have found to be true as well.
Good.
Kendall, thanks for that tip about writing down how you're feeling. I think that's really great to see change over time because that physical change doesn't happen in a day or two, but very gradually over weeks and months. So that's perfect.
10%.
We are coming up on the end of our forum, so we understand if you need to sign off, but I do want to just pop in a last minute discussion about the fitness trend Everesting, which is like Mount Everest. Most of us are not going to climb Mount Everest in our lifetime, but there is a trend to pick a type of challenge like that and complete the distance from your home workout options. So maybe if you're cycling, you find a hill in your neighborhood and you would climb that hill on your bike or running over time until you reach the cumulative height of Mount Everest. I know this past weekend, the American Lung Association did a stair climb, which is kind of a similar concept, where they were climbing the 680 stairs at US Bank Stadium as a fundraiser. So I want to open this up to Kendall and Matt as well, or the audience. What kind of fitness challenge have you tried in the past that has worked well for you?
Well, Michelle, most recently, just because my knee bugs me a little bit, I've been rucking. And what that entails is hiking or walking with a weight vest on. These weight vests are kind of trendy and popular, and we know I'm always on the cutting edge. So I bought one of these vests. And so what I've been doing is actually walking with that vest on a treadmill at a pretty significant incline. And I've found, and I just keep it there, and I found that it definitely gets my heart rate up as much as running, and I definitely get more of a muscle action into the glutes and quads, and also calves. It's pretty impressive, and it's not easy to do. Obviously, I vary somewhat. I keep the incline the same, but I vary the belt speed on the treadmill.
Kendall, how about you?
I wouldn't say mine is anything specific, but in general, I don't like to do the same thing over even just one time. So I like to try different things. I honestly, lately, I have not done a fitness challenge, but I try to do anything and everything that's new and different. So again, I'm not a person that likes to take the same class again. It has to be different. I get bored, and then I know what's coming, and then I'm out.
My challenges are always linked to vacations. So it was maybe 2 years ago, and preparing for some hiking in the Grand Canyon. So thinking about practicing how much effort it would take to get up and down hiking in the Grand Canyon. And most recently with a hike in Hawaii that was 1,200 double steps, basically straight up the side of a volcano. So practicing for those challenges.
Awesome.
And Kristen did comment, I'll just share this as we close out today. Everesting for some athletes is done all at once in one long multi-hour workout. For most of us, it is going to be over time, looking at cumulative workouts over days and weeks, because we do want to gradually increase that workout intensity to minimize our chance for injury, but maximize our chance for success. So thank you all. We went to 11:31 today. Fitness Intuition. We hope to see you in a couple weeks. July 21st, we're going to talk Olympics and cushion crusher exercises you can do from your home sofa. So we hope to see you then.
Bye, guys.